The Deputy Health Minister, Dr. Sibongiseni Dlomo, says his department will intensify the fight against illegal abortions by working hand in hand with law enforcement agencies. As part of Women's Month, Dlomo has assembled the youth from different schools in Ekurhuleni to march against illegal abortions. Here's what some of the youth had to say about this campaign.
Of this particular campaign is to educate the youth, particularly the women youth of South Africa, to utilize the sexual and reproductive facilities that the government offers to them. We have found that most of our youth, the ladies, in terms of teenage pregnancy, they end up resorting to your quick fix, behind the door pregnancy termination options, and that has become dangerous because it leads to fatalities. So if we can inform them that there are facilities available for them, they're not even in the clinics, they're isolated, so privacy is guaranteed. If they could just go to those facilities and administer any pregnancy termination, any STI and HIV checkups, or pap smear and cervical cancer screenings, they should actually do that, because the government cares about their health.
Most of the time, what you as a youth we are maybe scared to go at the clinic and using the right services. So that is where also as we groundbreakers come in, because we're trying to bridge the gap between the youth and also for them to get better services at the clinic. So as a groundbreaker, what I do as a young person, I understand your situation and I kind of relate to you, and then I make it easier for you, tell you to use safer routes and telling you you can go to the clinic and they're going to assist you, and if they have to refer you, they're going to refer you, so that you just make sure that you have a legal abortion. So most of the time they're discouraged because they're scared, and also they are afraid from the discrimination and judgment that they get from the community.
All right, taking this discussion further then, we're now joined via Zoom by the Deputy Minister of Health, Dr. Sibongiseni Dlomo, to give us more on this. A very good afternoon to you, Deputy Minister. Good to see you.
Good afternoon to you, ma'am, and thanks to your viewers and for this program.
All right, let's talk about this march then you had today against illegal and unsafe termination of pregnancies. How big of a problem is this in South Africa? If you can perhaps paint a picture for us, if you have those particular stats, sir.
I'm sure if you travel countrywide, you probably notice that these illegal abortion, quick abortion, safe abortion stickers are all over our towns, all over our cities. They are unsuspecting. We really get our youth attracted to this. So we're going on to a multi-pronged approach to say, maybe while we are really going to campaign strongly against this, how much are we doing as a department in terms of saying to young people, here we are in our facilities, we have a youth user-friendly type of a service, access it, use it, ask any question related to sexual and reproductive health services. We know that is a package, ma'am. We need to improve on it. And in the dialogue that we had just now in Germiston, young people were telling us those issues to say, make your clinics not to be judgmental to us, make it user-friendly, so that we can then move away from these illegal abortionists who are assisting us. The problem is really widespread, and all we are saying, if we actually are working with the municipalities to say municipalities, and we really had a big number of councillors from that metro saying this is actually damaging your street furniture. Yeah. These things are appearing there, and as we are removing these posters, some of the citizens were asking us, but why are you removing these things? We think these are good posters because the municipality is not doing anything about that. So we were actually bringing that awareness, and thanks to the support of councillors, they will be part of that. But again, we need to have these people who are doing these things prosecuted and therefore be charged. But we need to build a case, because in the country, there is nobody who has got a license to actually terminate a pregnancy of any woman except a nurse and a doctor. So we would want to get those arrests done, and we're busy talking to the police how we could move on with those processes. It really does have an impact. That very good actress from Skim Sam was talking about it. She was our program director, to say it has an impact on the maternal outcomes in the country. So we would like to really accelerate the fight against these illegal abortion stickers.
Deputy Minister, you briefly touched on it, and in fact, in the clip that we played prior to speaking to you, there was a young lady talking about the fact that, some of these clinics, the ones that have the stamp of approval from the Department of Health, some of these clinics or hospitals where one would go to for an abortion, they face, being judged, being discriminated against. Just recently, we saw a video of the Health MBC of Limpopo actually speaking to a patient and saying things to her, and one can actually tell that this sometimes does happen in public health institutions where people that are coming for treatment are judged. And a lot of people have raised this issue that they actually worry about the fact that if they go to an abortion, to a legal institution, they face that sort of attack or discrimination when they go there. So it's easy to condemn, Minister, as you've said, and you've been condemning this, you've been condemning the illegal abortions, but how exactly do you plan then to address this issue of young women who are saying, listen, we're actually just scared to go to the legal institutions because that's where we get judged. We know that if we go to these illegal centers, nobody's going to say anything. You pay your fee and it's done. What do you have to say in response to that?
No. They go to the illegal abortion services. They pay a huge amount, and you are correct. They are scared, and they are
Minister, that's not my point. Deputy Minister, that's not really my point. My point is, how are you going to address the fears and the problems that the young people are articulating and saying why they don't go to the legal government institutions where they should be having, safe abortions there?
No, ma'am, just give me space. I'm enhancing your point. I am saying it is free into our clinics, and yet people go and prefer to go and use the illegal ones that are very expensive. They are educating us, and they are saying to us, in that clinic and that facility, last year, I went in there to request a support for sexual and reproductive health to do a family planning. I did not get a good support. I did not get a good attitude. Now I am reluctant to go there. Now I'm pregnant. I need another service. I'm reluctant to go there. Hence, we are saying we are not excluding ourselves in this as the health department in terms of improving the attitude of our staff members. We are creating what we call youth zones countrywide. Currently, we have 1,917 facilities where you would find a nurse who is already trained on the programs of adolescent and youth-friendly services, at least one per facility. We're trying to have young nurses, as the people were saying there, please don't give us my mother's level, my mother's age nurse, because I won't be able to talk to that person. So in that, we are also listening to them. We have youth zones where they can go to a clinic and find a nurse who will understand and work with them through their problems and therefore work and not be judgmental. We are not saying this is happening countrywide, but our build-up is towards that so that they could say at least one clinic, I have one nurse that I could go and speak to, and she will understand my problems, or he will understand my challenges and help me as a young person.
Yeah. Deputy Minister, besides the issue of, attitude of, of nurses and so forth, would you say that clinics and areas that provide these particular services are, fully equipped and have, enough resources? Because, we've also been talking about the issue of a lack of resources in government institutions and government clinics and government hospitals. Is that also then going to be another problem that is perhaps raised in the long run while we address the issue of illegal abortions?
No, ma'am. They are not even raising it in the long run. They are raising it now, currently, to say, Dr. Dlomo, we appreciate this moving us away from the illegal abortion processes and creating a program within government. But somebody was even saying, in my province, and they were raising a particular province, I don't think the access is actually adequate. So I think that is also another process. In fact, as we were in Germiston, at least 6 of the hospitals in and around that area do actually have this service. Of course, not all clinics will be able to do it. Again, it's a procedure that you probably do it this morning, but somebody must be observed overnight and be discharged the next day. So you probably find that in the clinic that is not operational in 24 hours, you may not be able to do this service. So yes, that is going to come in. The more we are actually able to get our people to really use our facilities, the more we'll have to create the space, because the demand might actually increase. So I cannot vouch now and say, no, it's adequate. everybody's taken care of. We should improve on that as we go along.
All right. Deputy Minister Dr. Dlomo, thanks very much for your time. Much appreciated, sir.
Thank you very much, ma'am. Have a good day.
Same to you. All right. The Deputy Minister of Health, Dr. Sibongiseni Dlomo, they're talking to us again about that march today against illegal and unsafe terminations of pregnancy.